I'm Susan Worth, Bell Alliance Transitions, and we're here today with Dean Malone, CEO of Plum Living. Dean, thank you so much for coming in today.
Thanks, Susan.
What is Plum Living?
Plum Living is a home health care service that's specifically intended for lesbian, gay, bisexual, transgendered, and queer adults, where we provide services in people's homes.
Okay, so what would be the differences between something like nursing support and non-nursing support, or medical and non-medical home support?
We provide both. The nursing services we provide could be for a very specific period of time, such as when you're discharged from hospital and have acute nursing needs, or they may be ongoing to deal with a chronic condition or an end-of-life situation where someone requires nursing care at home, which is very specific and requires the specific skills of a nurse. And our non-medical services are provided anywhere from companionship to housekeeping to not nursing care, but registered care aides or professional caregivers providing some personal support in addition to some home support.
Okay, and would these services be user pay, or is there some government funding available to help cover the costs?
The services we provide are private pay services, though we are also a Veterans Affairs provider, and for some individuals who have support from provincial programs, they can use that funding to utilize Plum Living.
Okay, so in working with the lesbian, gay, bisexual, transgender community, what are some of the challenges that are unique to this community, specifically with seniors?
Yeah, for the older LGBT population, it's finding us. Many of these individuals who are older or very old have gone through a period of their life where they were diagnosed as sick or strange, have spent a lot of their adult lives in periods where there was no understanding for who they were as people. And so taking the risk of inviting other people into their lives is a big one, especially within a healthcare system that hasn't done necessarily a very good job of recognizing LGBT health issues or just their life issues and being able to respond to them.
So it sounds like there are some other challenges that they face in terms of isolation and trust that maybe other aging populations don't face.
As compared to the mainstream population, more LGBT will grow old alone because historically we haven't had children. We may have been estranged from our families, or we've chosen to be away from families and friend groups. And this applies as well to mainstream, but as we get older, if we've surrounded ourselves with people of the same age, which is a great idea, except if we're all 90, we're not able to support each other. And so the LGBT community, one of the unique things, because we've created families of choice, is that many of them have younger friends that they have included in their lives, and that's a big piece for them to have the support that they need as well.
Do you think that other private companies that provide this type of support, or even the public system, have a good understanding of what the lesbian, gay, bisexual, transgender community needs or the challenges that they face?
Generally, no. There are pockets of understanding, and I wouldn't want to say that there's no understanding, because LGBT people work within mainstream home care provision, not necessarily providing care specifically to LGBT, and so that helps. But for the most part, it's not well understood what we need. And I think often people look for this big checklist of what makes us different. And so we know that if it's this person, this is what we're going to need because they're lesbian or gay. Not the case. We do have higher incidences of certain conditions, diseases, certain concerns that are more prevalent in the gay community, but certainly many of our basic needs are the same.
So what would be some of the challenges that your support workers would face when going in to begin working with a client who may have been isolated and maybe doesn't have the same willingness to trust strangers?
Well, trust is exactly the piece. It's gaining that trust that, first of all, they'll be respected, but perhaps even celebrated in who they are, that they've got someone that they can not go back in the closet when they're in their home or have to put things away, that the conversations they have can really be a reflection of their life and their continuing life as an adult.
Do you find that some of your clients do have a solid family support system in place, or are the majority really ones who don't have family?
I would say that the younger crowd, so the 50 to 65-year-olds, are more likely to have friends and family, whether that be original family or families of choice. Mm-hmm. For the 65 to 90-year-olds, or even the, not to age categorize, but even the over 75, fewer and fewer can identify someone to call. If we go into their home and need to call someone, there's no one to call other than 911. No one would know if they were missing or ill.
So is that a role that you play then, and that your caregivers are able to play, that they keep vigilance over the people who may be alone and isolated?
Well, we do. We operate, we're 24/7, and so our clients can call us anytime, day or night, and they do, with a number of things. And sometimes it's not really serious, but it may be serious for them in that they put themselves at risk by they've fallen and can't get up, and they don't have anyone to call. And calling 911 in those circumstances often can trigger a whole series of events that were unnecessary, but because it's an older person calling, they may end up somewhere within a system that they don't want to be in, and that can happen in the gay community and in the mainstream community as well.
Now, do you have any advice for professional service providers in the private or in the public system, and how they can best address the needs of the LGBT community?
Mm-hmm. You need to ask on your intake about gender and sexuality, and that's important. Some clients may not get it and wonder why you've asked the question, but you need to open that dialogue when clients come into your service to give them an opportunity to disclose, and know that if you're smart enough to ask the question, then obviously you've thought about it, and at that basic level are open to clients of diverse backgrounds, including gender and sexuality.
Mm-hmm. And do you have any advice for people in the community who are either needing support services for a loved one or for themselves?
Call somebody, ask for help. Many people won't ask for help, especially if they're older, because it wasn't within their thought or vocabulary. And often what people are looking for is not necessarily quantity of life or an extension of life, but I think we all talk about quality of life, and making some decisions early can make a really big difference to the quality of life that you will have, and it will impact the length of life that you have. But yeah, phone, ask for help. Asking for help is okay.
That's great. Thank you so much, Dean. We'll have your information on the screen so people will know how to be able to get in contact with you. Thank you so much for being able to come in and speak with us today.
Thanks, Susan.